Root canal treatment is a common dental procedure that is necessary when the pulp inside a tooth becomes infected or inflamed. During a root canal, the infected pulp is removed, the inside of the tooth is cleaned and disinfected, and then the tooth is sealed with a filling or crown. While the purpose of a root canal is to save the tooth and alleviate pain, many people wonder what the recovery process is like after the procedure. The recovery process after a root canal can vary from person to person, but there are some common steps and guidelines that most patients can expect to follow. In this video, we will discuss what the recovery process is like after a root canal and provide some tips for a smooth and comfortable recovery. 1. Pain management. One of the most common questions people have after a root canal is how much pain they can expect during the recovery process. While some discomfort is normal after a root canal, most patients experience only mild to moderate pain that can be easily managed with over-the-counter pain medications like ibuprofen or acetaminophen. Your dentist may also prescribe stronger pain medication if needed. It is important to follow your dentist's instructions for pain management and take any prescribed medications as directed. Applying ice packs to the outside of your face near the treatment area can also help reduce swelling and alleviate pain. 2. Eating and drinking. After a root canal, it is important to be cautious about what you eat and drink in order to protect the treated tooth and ensure a smooth recovery. For the first few days after the procedure, it is best to stick to soft foods that are easy to chew and will not put too much pressure on the treated tooth. Some good food options include yogurt, mashed potatoes, soup, and scrambled eggs. Avoid eating hard or crunchy foods, as they can potentially damage the tooth or cause discomfort. It is also recommended to avoid hot or cold foods and beverages, as the treated tooth may be more sensitive to temperature changes during the recovery process. 3. Oral hygiene. Good oral hygiene is crucial for a successful recovery after a root canal. It is important to continue brushing and flossing your teeth as usual, but be gentle around the treated tooth to avoid causing any pain or irritation. Your dentist may also recommend using a prescription mouthwash or fluoride treatment to help prevent infection and promote healing. In some cases, your dentist may advise you to avoid brushing or flossing the treated tooth for a few days after the procedure to allow it to heal properly. Follow your dentist's instructions carefully and ask any questions you may have about oral hygiene during the recovery process. 4. Follow-up appointments. After a root canal, it is important to schedule a follow-up appointment with your dentist to ensure that the treated tooth is healing properly and that there are no signs of infection or complications. Your dentist may take x-rays to check the tooth's healing progress and make any necessary adjustments to the filling or crown. During the follow-up appointment, be sure to discuss any concerns or questions you may have about your recovery process. Your dentist will be able to provide personalized advice and recommendations based on your individual needs and circumstances. 5. Signs of complications. While most root canals are successful and have a smooth recovery process, it is important to be aware of the signs of complications that may arise. If you experience severe pain, swelling, or bleeding after a root canal, contact your dentist immediately for further evaluation and treatment. Other signs of complications to watch for include persistent sensitivity to hot or cold temperatures, a bad taste in your mouth, or a visible pimple on your gum near the treated tooth. These symptoms may indicate an infection or other issue that requires prompt attention from your dentist. The recovery process after a root canal is generally straightforward and manageable with proper care and attention. By following your dentist's instructions, practicing good oral hygiene, and knowing what to expect during the recovery process, you can ensure a smooth and successful outcome after your root canal treatment. Remember to communicate with your dentist if you have any concerns or questions about your recovery, and trust that they will provide the guidance and support you need for a healthy and happy smile.